This will be a panel of folks talking about their memories and experiences with Jane. And then we will also be taking questions from the audience. If people could put their questions in the Q&A, that would be great. And we'll pose them to the panelists. And then we will share information or materials in the chat. And the chat will not allow the audience to chat with each other, but people can send us messages. So just to start, for folks who might not know Jane, she was a renowned psychiatric epidemiologist who was former professor in the Department of Epidemiology at the Harvard T.H School, and pioneer in promoting mental health research. And she led the Stirling County Study, which I'm sure we'll hear more about today, which started in 1975. She was a cherished colleague, mentor, and scholar. She was a member of the Department of Psychiatry since 1984 at Mass General Hospital, director of the Psychiatric Epidemiology Unit, and a professor of psychology at Harvard Medical School as well. She was also an adjunct professor of psychiatry at Dalhousie University in Nova Scotia. At the Harvard School of Public Health, most notably, she was really a leader in the psychiatric epidemiology training program, which still exists, and really drove a lot of the mental health research out of the school and mentored many people, some of who are on the panel today. In terms of my own career, she had a really big impact because she's actually the person who approached me about a position at Harvard. I was an assistant professor at BU and at the Boston VA. And when she was recruiting, Harvard had an open position in psych epi in the social behavioral sciences department. And Jane emailed me and asked me to apply for the position. I'm not sure, I still don't know where she ever got my name from, but if she hadn't emailed me, I never would have applied. I'd actually seen the position posted several times and people had even sent it to me, and I deleted it thinking Harvard would never give me a job. Here I am still, but so I didn't apply. So if Jane hadn't reached out, she was chair of the search committee, I never would have applied, and coming to Harvard had a big impact obviously on my career, and here I still am. So I'm really grateful to Jane for that. So like I said, to get started, we will have a few presentations from folks. And I'm just checking to see if Deborah is back. So, I'll do brief introductions, and then they will do their little presentations, and then we'll take questions and answers. So I'm going to start with Dr. Deborah Blacker. She is professor of psychiatry at Harvard Medical School and deputy chair and professor in the Department of Epidemiology at Harvard Chan. And she's a geriatric psychiatrist and epidemiologist at Mass General Hospital, where she directs the gerontology research unit and serves as associate chief of research in the Department of Psychiatry. And I'll let her start by talking about Jane. Thanks, Deborah. And I understand you have some internet issues. So if something happens, we'll just move on to the next person.
Okay, so I'm just getting my computer restarted.
Okay.
So, and I need to share my screen. So give me 1 second. And I assume I have permission. And so tell me if you can see my screen, someone. And can you see it as a slideshow?
It's
now it's a slideshow.
That's good.
Okay.
Awesome.
Thank you, everybody. And sorry for the mix up. I'm really grateful to be invited to do this today and sort of kick off this discussion of the contributions of Jane Murphy. And I'd like to start by talking a little bit about one of Jane's major contributions, the Stirling County Study, which was an absolutely seminal study and continues to this day in data analysis, as you'll hear more from Dr. Gilman. But I wasn't involved in the Stirling County Study at all. So the talk that I give will be a little bit more about personal and mentorly relationships and less about specific collaborative work. Before I start, I'd like to say something about mentorship as family. And the reason is that I'm speaking to you here from San Francisco. And in fact, that's more or less the view out the window where I am. It's why you see so much glare. But I just lost my dad last week. I'm here in San Francisco, and that's really made me all the more grateful for being part of this and giving me a deeper understanding of what events like this mean to us as a psychiatric epidemiology family, and also to Jane's family, knowing how much we cherished her at work. And my understanding is that members of the family are here today, and we welcome you with open arms. I think Jane would be very happy to see this event with former mentees of hers, some of whom are also mentees of mine. And there's something about family in that too. And for me, that has a special meaning this week. I also wanted to show a picture of a mug that we actually have in our house here for reasons I don't quite understand, but it's a picture that Jane had on her wall. Like, I see Stephen smiling because he recognizes it. And she talked about this guy and how much she liked this. It's a portrait of a Scottish curate from the 18th century. But what she liked about this guy is his sort of resoluteness of character and determination. And those are things she admired, but there are also things that she embodied. And I think for all of us trained by her, part of her mentorship was that special character that she had. And I think as I noticed in the notes that people sent around when we sent the notice of her passing at MGH, many women in particular noted how important it was to have a female mentor with that kind of stick-to-itiveness in the generation ahead of us. And it's one of the many things that I cherish about Jane. So when I talk about the role in my personal career, again, it's a little bit more about process. Jane was one of the first faculty members to welcome me to the school. Susan Sanangelo introduced me to Jane in a hallway at MGH where all three of us worked a few months before I arrived. Jane was a key member of the leadership of the psychiatric epidemiology group. This is a chance to see all of us in our younger days, or many of us. And I felt always very welcome there. And I'm grateful to the school, and particularly to Brian McMahon and Michelle Williams and now Barrett Hoffman, to the department for making psychiatry feel a really critical part of our epidemiology program. And the first really major thing Jane did was hand down the leadership of the Psychiatric Epidemiology Colloquium, which is the predecessor to this symposium series. It's the major event of our training grant. And this is not when Jane was the leader or I was the leader, but when Stephen, to whom I handed down the colloquium, was. And this is us presenting an award in psychiatric epidemiology, which was part of the annual program, to Jane herself. And it's with me and Garrett as, at the time, leaders of the training grant. And last, and probably most important in my career, was that Jane's career, I think very fitting for someone trained as an epidemiologist, was very much focused on measurement and on the nosology, and thinking clearly and precisely about the impact of how you ask questions on the answers you got in your research. And these are three papers that in a hurry this morning I grabbed to put on a slide, but I think she's very well known for ROC analysis. But some of these other papers, I think one of the, which Steve is a co-author, there were also some papers that I saw about the bereavement exclusion. She thought so carefully about these things, both in terms of applying data, but also applying logic, applying careful reasoning, and understanding what the implications were when you measured things differently. And that's really, I went through my own CV and counted, and I'd say fully a third of the papers are in this area, and every other one is imbued with the lessons learned in this area. And I feel that that's been the lasting impact of Jane on my career. I couldn't be more grateful to have a chance to say thank you to her, and another chance to say goodbye. And I will pass the torch back to the next person and stop sharing.
Thank you, Deborah. That was beautiful. Next, we have Dr. Josh Bresla, who's a senior behavioral social scientist at Rand Corporation, anthropologist, and a psychiatric epidemiologist. And his work focuses on the social and cultural influences on the onset and course of psychiatric disorders and mental health services. And so welcome, Josh. He also was at Harvard back in the day.
When we were all
younger, much younger.
that happened. Thank you so much, Karsten, for inviting me and for organizing this. It's an honor, and it just feels like so important to be recognizing Jane's contributions, her career. And this was completely unplanned, but I think we're gonna already start seeing some repetition of themes here across, that really came through in the many ways Jane contributed to science and to the careers of so many people. I wanted to make a few comments, kind of both personal, educational, and scientific. On the personal side, the first impact that Jane had on my career was in 1988, in letting me know about a job that was available, opening up, and this was before I started graduate school. It was opening up at the Massachusetts Mental Health Center, working as a program evaluation coordinator with Harvard T.H. And I applied for and got that job, and I worked there for several years. It was a fantastic introduction to the field. A great thing for me to have done between college and graduate school. And then 12 years later, after I had a PhD in anthropology, Jane told me about the postdoc opportunity in psychiatric epidemiology at the School of Public Health, which I ended up doing. And then about a year later, she raised the idea of me doing a doctorate in epidemiology, which I have to say, it takes a certain kind of bravery to suggest to somebody who already has a PhD that they do another one. It was, completely ridiculous idea to me at the time, but it actually ended up making sense for a lot of life and career reasons, and turns out to have been, one of the better decisions I've made. So Jane has really had, been there and participated in major decision points in my life as well. I had the real pleasure to work with her while I was a student at the School of Public Health in teaching, taking her class and teaching the class with her on interviewing in psychiatric epidemiology. And that was such an important, it was an arena in which she really put forward her core values and intellectual ideas about the basic issues that Deborah has really kind of highlighted already. And she really, in an era where we can all kind of download massive data sets, she really pushed and emphasized the importance of giving students basic experience of conducting research interviews, and attention to the choices that are made in classifying cases. You're really like one case at a time, the process of doing research, and felt very strongly that students should have that personal experience of sitting with an interviewee, whether that was a patient or a person from the general population, and conducting an interview. And that was different. Even clinicians who have, of course, many clinical interactions should also have this experience of doing a research interview, which is really fundamentally a different kind of interaction. I think that's just such an important core value, something that we should certainly be preserving. On the scientific piece, one thing that I'll mention that I think is something that really sticks with me today is her, and it echoes with the issues that Deborah brought up, was her focus on the care and attention to detail and analysis that she brought to the question of historical trends in the prevalence of psychiatric disorders, and in particular depression. And I don't think there's anybody who's really brought that, even today, who's really brought that kind of attention to what is, obviously such a core and important issue. So many of our studies, even if, prevalence of X, Y, or Z disorder is kind of the top headline that gets reported, the prevalence, as we know, is kind of an artifact of other decisions we make about methodology. It is really the most important or interesting piece of what we do. But when we start looking historically, as Jane was, and there are such obviously compelling reasons to do that, those issues about the reality that of prevalence become extremely important and become critical. She really understood the difficulties in conducting a rigorous comparative temporal comparison, where you have instruments that are changing, sampling methods that are changing, survey methods that are changing, measurement characteristics of instruments in populations that are changing over time. Population changes with migration, all of these issues that are often overlooked, and I think we often see today very somewhat simplistic presentation of trends that are focused on kind of very narrow range of measurement results. She really refused to set aside and kept core. And I think that's something also is really a major scientific importance, and something that I will, I think is part of Jane's contribution. So thank you again, Karsten. Really appreciate being included in this important memorial.
Of course, Josh, thank you for doing this. Thank you for that. And outlining some of her most important contributions. So next we have Dr. Stephen Gilman, who is currently Chief of the Social and Behavioral Sciences branch of the Division of Intramural Population Health Research at the Eunice Kennedy Shriver National Institute of Child Health and Development, where he's also a senior investigator. And he is also an adjunct professor in the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health. And he's a social epidemiologist who's done a tremendous amount of work on the persistence of social, ethnic, and racial inequalities and common mental disorders over the life course. So thank you, Stephen. Nice to see you.
Thanks. Great to be here. Let me share. And I think we are glad to see lots of consistency in all of our comments, which is great. Okay, do you see my slide full screen? Okay, great. Well, it's really an honor to be here. So Jane was a dear friend and colleague to so many of us, and we feel her loss so deeply on a personal level. She was also a giant in psychiatric epidemiology. So I wanted to share some thoughts that connect the two. So Jane led an exquisitely principled life, a life dedicated to mental health and communities. Her life and work were so closely linked together that her own unique qualities as a person are reflected in the principles that guided her scholarship. And so I wanted to talk about 3 of Jane's principles for epidemiology: study design, measurement, and academic life. So Jane's principles of study design actualized her strong theoretical grounding in anthropology, her commitment to understanding over very long periods of time how social processes influence the mental health of individuals. Her anthropologic lens focused on the individual within her social and cultural contexts. So as Josh said, Jane had an enduring interest in time trends. Because she understood that societies are continually in flux, and so time trends provided a natural experiment of how social conditions operated on psychiatric illness. She always had her eye on the next problem And so I just wanted to tell you what that next problem is. So our next project that Jane recently set in motion arises from the fact that for 40 years of the Stirling County Study, depressed men had an excess risk of mortality, only men. In our recent work extending the Stirling County Study by 20 additional years into the 2000s, we found that women finally caught up to men. In the last 2 decades of observation, both men and women with depression had shortened life expectancies. What Jane saw in these findings were the ramifications for women's health of sweeping social change. And so we hope that we will continue this work to understand these ramifications further. And Jane set the stage and really implored us to continue working on this problem. Jane's principles of measurement begin and end with understanding. How we understand what mental disorders are, how our participants understand us, how we understand and respect and value our participants. Jane thought deeply and broadly about the nature of mental illness, particularly about the core features of anxiety and depression. And as much as she dealt with the changing environment and mental illness, she also helped the field understand how stability and change, or as she wrote, continuities, in the diagnostic process changed our assessment of them over the years. And of course, the diagnostic process had to be implemented at the level of questions and algorithms and computer programs, which Jane wholeheartedly became a master of. So Jane's dedication to the Stirling County Study and to the people of Stirling County and to the people of Stirling County who were in the study teaches us that compassion and empathy are core features of the process of understanding. We see this again. Many of you will remember this print of the skating minister that hung in Jane's office. So I remember asking her why she always had this old guy hanging around all the time. And her response was, it reminds me of how I see academic life, to always move forward and with grace. And she was always quick to point out how graceful this painting is. And then Jane unfailingly did that. When Jane started out, women's status in academia was not even what it is now, such as it is, but Jane was always moving forward, seeking a better understanding of the social causes of mental illness with tenacity, dedicated to fostering junior careers, and always teaching by example how to become and how to be a scientist. So Jane is one of those very special people that everyone has their own unique story about. How she shaped them, mentored them, was a friend, an aunt, a neighbor, a trusted colleague. My personal friendship and collaboration with Jane is so unique in my own heart, but I know it's not unique at all because many of you shared similar connections with Jane. Her legacy lives on not only through her scholarship, but also through those connections, which are now our responsibility to pass on to others. So let me stop there, and thank you very much for hosting this event.
Thank you so much, Stephen. That was beautiful. I love the last picture of you guys in Stirling County. So finally, we'll have on this panel, we'll have Dr. Olivia Okariki, who's a board certified geriatric psychiatrist and associate professor of psychiatry and of epidemiology at Harvard Medical School and Harvard Chan. She is director of geriatric psychiatry at Massachusetts General Hospital. And she has done a lot of work on identifying modifiable risk factors involved in adverse aging and translating that into strategies for large scale prevention in late life depression and cognitive decline. So thank you, Olivia, for joining us.
Thank you. I'll get my slides shared here. Okay, and go to full screen. There we go. Do people see this full screen? Okay, then we are good. Well, I'd just like to thank once again, Karsten and all the panelists and everyone who's here today. This is a wonderful opportunity to acknowledge Jane. I had the pleasure of meeting Dr. Murphy for the first time at Mass General Psychiatry, as I was a resident in the Mass General McLean residency training program. And then later in the year I graduated from the residency as a student in epidemiology at Harvard Chan, I was a student on the T32 in Psych Epi training grant that Deborah had alluded to earlier, and so many people have been involved in and participated as mentors in. And so that was the first context, in which I interacted with Jane, and that role of hers as a teacher, which we all know is something she took incredibly seriously. She was a lecturer in the psychiatric epidemiology courses I was taking at the time. And, my initial impression upon meeting her was, she's just someone who had a tremendous breadth of knowledge and understanding about important things, and who could take a lot of complex information and present it digestibly and simply, as if that's like easy to do, which of course it's not. But she could do it. And that was one of her gifts, one of her many gifts. And she had a wonderful narrative style, I think, to the way she presented things, the building blocks and her logic and the larger arc of the cases she was making in terms of pulling together her study conclusions. So I learned a lot from that. And some years later, I would have the privilege of becoming a course instructor at Harvard Chan for the Epidemiology of Adult Psychiatric Disorders course, or EPI 217. And I asked Jane if she would be kind enough to return to teach the session on the epidemiology of major depression, as I knew only she could, having heard her present on this topic when I had been a student. And it was so reassuring. She was a very reassuring presence for me when she did this, because it was the first time that I was teaching it. This was almost 10 years ago, and I was quite apprehensive. And it was wonderful to have her there and be part of this. And one of the highlights of that experience was just sort of being able, during her session, to kind of sit back among the students and to kind of take it all in. And when Jane described her studies, the details of her methods, which we've heard so beautifully described earlier by Josh and others, her approach, her results, she brought this remarkable historical perspective in which all that work could be framed. And so, it's been said many times, at the start of this event, Jane was a pioneer in so many ways, and that's because it was just true. I'm just amazed when I look at the way she helped launch the entire field of psychiatric epidemiology. And I was thinking about this. She was doing this before organized psychiatry even had names or a terminology, or even a framework for a terminology for many of the psychiatric disorders we now recognize and treat. And yet Jane and her team were able to, identify, delineate, describe these important nuances and gradations through careful measurement of a continuum of mood states versus clinical disorders, important distinctions that remain very active topics in psychiatric research to this day. Decades before NIMH developed the RDoC framework about a continuum of mental disorders. I mean, that's just an example of how pioneering Jane was, and it was just amazing and delightful to see her do that and then bring that to our students. And it could come alive for us as she described the story of her work and its place in psychiatric history in a way that could not otherwise be described, because she was the one telling it herself in the first person. And I feel that her work contributed to so many critical concepts in our field that some people have almost come to take for granted in some ways, but obviously shouldn't. But for example, and we've heard a little bit about this, but the twofold higher prevalence of depression in women compared to men. We heard, references to her important work about looking at the prevalence of depression in younger compared to older cohorts. And of course, the major contribution of social circumstances, of social advantage versus disadvantage in the population, and how that plays out in terms of how people, some people have protection versus some people being at higher risk for depression and mental disorders. So it cannot be overstated how important her role has been in this regard. But I'd also like to say, she has so many of these wonderful accomplishments, but I just kind of also want to say in a personal level that I always loved Jane's sense of humor, which was very wry. I love the way, her way of relating stories, any kind of story, whether an anecdote or a description of some, trajectory and the research she was doing. She loved to surprise people, and this would come out in class. She loved to be surprised. in her findings. And she knew the value of the unexpected and how that could take her work in important new directions. And then when relating her studies and results to students, she relished this ability to surprise us with something counterintuitive, something that we would not have expected. And she would have the most wonderful wry smile and sort of twinkly eye as she did this. And that was very characteristic of Jane. So I like to remember that. I like to remember all those things. And I will remember her warmth, this humor, her remarkable brilliance, and as we heard before, this precision and clarity of her thinking, thoroughness and attention to detail, but also just being warm and collegial and caring, and above all, being a very devoted teacher and mentor to me and to so many. So thank you, Jane, and thank everyone for sharing your thoughts today.
Thank you, Olivia. That was very moving as well. So thanks everyone who presented. So now we're at the Q&A portion. And if people who are on, it's actually, if you look at the names of the participants, it's many people who I know also were influenced by Jane. If you want to share something, you can put it in the chat. I can read it, or you can add Q&A. I have some questions for the panelists. So one thing I was thinking about while we, when we're preparing for this was, we are at, this loss of Jane is at a year, we're doing this memorial at the end of the year, or what is there, 15 months of a lot of loss for a lot of people. So I just want to acknowledge that. I mean, Deborah acknowledged her father in the beginning and sort of kind of brought that up for me. But in terms of, and now mental health, all of us, we all study mental health. So we've always known the importance of mental health, but now it's sort of, again, with COVID, it's been back in the sort of attention to it publicly. And I wondered what you think, Jane, if you could give one piece of advice, or you can do more than one, that Jane would give students entering the field who are interested in mental health, what you might say. And you've said some of that, but if Jane were here and the students, were saying, Jane, what would you tell me to do if they're thinking about their careers, launching their careers? What advice might you give them? So I'm gonna start with Stephen.
What advice would Jane give? I don't think she would, I think she would ask you what you wanted to do and then elicit out of you, sort of help you figure out sort of a very practical way to do that and help you articulate. And if you weren't certain what you want to do, she would help you make it clear that you didn't understand yet what you wanted to do. I think that was this very sort of unique skill that she had.
It's lovely. I don't know. Josh, do you have a thought on that?
No, I'm trying to think. I think she, the focus that on methods and understanding and kind of driving back to kind of the fundamentals of how our data are made and how those kinds of decisions that get built into our studies. I think those are such core things that she would have. I actually would have emphasized them kind of their importance even more kind of in the current situation where there are so many there's so much kind of going on the surface and that might distract from paying attention to those fundamentals.
Thanks, Josh. Deborah or Olivia, do you have?
I think people talked a lot, and I regretted as soon as I saw Stephen's outlines is that they talked a lot about grace, which absolutely was part of her personal style. And I think both Stephen and Josh are right. In other words, she would be directive about methods because it would be important for people to, whatever they did, to be precise and thoughtful. And she went from 30,000 feet to the details very seamlessly. and sort of to get people to have that perspective. Make sure you like think about what the question is and what it means to get an answer, but then look at the details of how that comes about and the influence it has. I think she's super directive about that, as well as leading by example. But in terms of your own life, she had that remarkable skill where you wouldn't even see the advice because it would be all about asking you questions. So a very Socratic way of getting people. That incredible personal grace that she had, I think, would come out in that setting. And I heard it in everyone's talk. I mean, that was so moving to hear everyone else talk about her, because you could tell everyone was talking about the same person. It was
very true. Yeah. I don't know, Olivia, is there anything you wanted to add there?
Yeah, well, I would agree with what Deborah just mentioned, and and Stephen and Josh as well. I think she would be able to frame this for students in a way that calls upon the discipline of methods and of thinking that she applied, and she would have this subtle way of just sort of getting you to attend. In a way that you could kind of clarify things in your own mind, but without being too directive. And I think she would encourage students to know that they made the right choice. They're in the right place. The work in epidemiology is more important now than ever. And the way that she works so hard through things, for any student, entering right now at this point in the pandemic, I think she would be able to highlight for them, this is why it's so important to do what you do well. The stakes are high.
Can I?
Well said. Yeah, go ahead.
Add something
Yeah,
to Kirsten?
yeah.
I think if Jane were here, I mean, who knows? But I think if Jane were here, she would also say, well, don't, you have to say something about Alec too. And I think, one of the, Jane was her main collaborator, and over the years was her husband, Dr. Alexander Layton, and they had were there at the start of the Stirling County Study in the early 1950s, or the planning in the late 40s. And I think through that, watching that model of collaboration, and I didn't step in, I didn't get to see them actively as collaborators, because I was just a student at the time, but she spoke, that collaboration was such an important part of her work and her personal life, and that they're so intertwined. And I think that is part of the legacy as well, and clearly the field personally.
Thanks, Stephen, for bringing that up. That is, and she would always acknowledge that too, even though I knew her like sort of later, but that is really important. One of the questions, Stephen, that came up in the chat was folks wanted to hear more about the plans for the Stirling County Study. Would you mind sharing more about what your plans are? You mentioned a bit in your presentation.
Yeah. Well, Jane was really, I mean, the most important thing is Jane was really passionate and committed to the Stirling County Study data living on, because of how much she valued the participants' role in the study. So she spent considerable amount of time preparing the data to be public access. And you can, so that I would just say the data at the Harvard Dataverse. And she was carefully, meticulously planned, prepared all the documentation of that. So I think that public access is one way that the study will live on, and that our active projects, I know she would want those to continue. I see Rebecca Huck is on the call, and she's one of our collaborators, and we're gonna, and Nick, I don't know if Nick is there, Nick Horton. So I think we're planning to move forward and continuing the work in progress, and see what additional collaborations go forward. The issue of gender and depression over time is one that she never stopped talking about, and was one that she never let us stop talking about, because she was just so passionate about and committed to understanding why it is that these secular changes were impacting women's mental health, and what it was about women's participation in the labor force, women's status sort of in the community and in the family, and how that affected their mental health and long-term outcomes of mental health.
Yeah, I would say her interest, some of the times I heard her talk is partly one of the things that made me realize when I got very interested in studying the intersection of mental and physical health when I worked as a psychologist at the Boston VA hospital. And I just had patients who had PTSD and were suffering from chronic disease. And Jane, it was actually during my search committee, my dinner at the faculty club, where she helped me realize that actually that was something I could study using psychiatric epidemiology, which is a big area of my research. So thank you for, she recognized that kind of very early. You know, did so much of the most important work on that. So Maurizio Fava, chair of psychiatry at MGH, asked a question. With COVID-19, we have seen a tripling of the rates of depression and anxiety among 18 to 24-year-olds in large US surveys. How would Jane have interpreted this, and what might she have said? Does anyone want to take that one on? I was sort of thinking that too, how she, or maybe, I don't know if Stephen, if you had, because I know you guys were working together till shortly before she died, if you had any conversations about,
Well,
you didn't talk about COVID.
I know I always, I think, we're deeply concerned about people in our lives who are stuck inside alone during the past year. And that certainly applied to Jane. And we had many conversations. She finally picked up Zoom towards the sort of mid part of the pandemic. So that was good. But I think she maintained her social connections through remotely through neighbors and close people in Boston. And um, I guess I would think that aspects of the social support and social connections and how that impacted people is what she would talk about, and also aspects of the economic circumstances that were impacted by the pandemic. She was keenly attuned to, and I think she would talk about that. But I would never put words in Jane's mouth ever. I mean, not even in a lunch when we were together would I have put words into Jane's mouth. So this is like a way out there speculation from many caveats.
Although I think, not to put words in her mouth, but something that I think it was you just talked about is her interest about women and the work life and home. And that was one of the things in the pandemic, both for women in particular and for young people in particular, is that training and early career and the intersection of that with parenthood for people was enormously stressful in the pandemic. And I think that would be the kind of thing that she would latch onto as an important area for why COVID was putting people in a particular kind of tailspin.
I agree. I think Jane would be very thoughtful about, sort of picking up on what folks have said about her attention to secular trends and the influences on those trends. She would be very attentive to the unique historical context and nexus of a number of challenges socially for people who are 18 to 24, as Maurizio was pointing out. The loss of the ability to participate in social events and rituals that often mark important life transitions that are happening for people in that age range. The loss of the ability to take advantage of the social connections that are so incredibly important at that age range, but also, as alluded to, also the social, political, and economic context in which the pandemic was occurring. I think she would just be very attentive to all of these things, the gender differences, the unique influences for people based on gender or certain time periods in their life within the lifespan. I think she'd be very thoughtful about that. And I agree with Stephen. I'm not going to speculate on how she would interpret it and put it together, but I do believe that these are the things she'd be very mindful of right now.
Yeah. Well, also this pandemic occurred in the midst of an election, and she had lots of strong political views, and was not shy about talking about where she stood in politics and the election, and how important it was to people's lives.
Yeah.
Somebody
just to add, I think she would have had a healthy dose of skepticism about measurement and what we're calling disorders here. She would have thought a lot about, her own work on demoralization versus disorder and what it is we're really picking up in these surveys. And she would have wondered why, and I think that, these issues that are specific, say, to younger groups, why not older people who were, clearly had the most direct threat from, the disease itself, but we really don't see the big impact there. What is it about the younger group? I think would have, those questions would have been the ones she would push.
Deborah, were you saying something?
I was just noticing that Lori Ball had written in the chat how glad she was that Jane got to live to see Biden's election, that it was something that she talked about a lot. And if she didn't get to see some of the recovery that's going on now, she was able to anticipate it for that reason.
So some of the things people have said in the Q&A is about how much fun she was, that she used to call. She would just say that she was their great Aunt Jane because she was great. She was fun and never boring. Some of the things that the emails I got after I sent out an announcement after she had passed, someone mentioned, I can't remember who mentioned, that she loved dancing, other people, and that she was a lot of fun. So so she obviously had that side too. Thinking about the more personal side of people's relationships with Jane, or is there anything there any memories there that people want to share, or something they know about? Go ahead, Deborah. Yeah.
There's one thing, I think that I joke with my son because I like, when I'm a little old lady, he's like, he doesn't want me to be a little old lady. And I'm like, what's the alternative here, right? But I think Jane really had the look of sort of the classic, almost prim little old lady. And one of the things I loved about Olivia's talk is that was so far from the truth. She had such an incredible sense of humor, dry, but very present, and such a sparkle in every way. And that idea that surprise of how she was in life and how much fun it was to hang out with her and talk. And that comes in the comments, not just from family, but from colleagues. And it was the first time I cried during this was Stephen showing that picture at the end. But she really was somebody who was a lot of fun. And in a way, it belied the presentation, which had a sort of primness about it, but there was nothing prim about Jane. She was just had a sharp wit and was a great deal of fun. And I very much appreciated spending time with her.
Anything anyone else wants to share on that theme? What would she like to travel with, Stephen?
Well, Jane was delightful, and she had me up to Stirling County, and it was a wonderful weekend. 3 or 4 days, and so being together and having her show me around, and she wore me out tirelessly. She actually had to do all the driving because I couldn't drive her car, and that was a little bit embarrassing to me. So, but so it was a really great 3 days, and this was sort of at the beginning of sort of a little after our collaboration started, and I realized during that trip that the reason for me to go there wasn't to have a vacation or see the place or spend time together. It was that she felt it was so critical for me that because at that time we were planning on writing a grant to do additional follow-up work with the participants in the Stirling County Study. She said, if we're going to really do this, you need to come here, you need to meet these people, see the place, understand the geography, the culture, the history. And it was a 3 or 4 day history lesson of the geography, topology, communities, the economics, religion of all of the place and the people. And without understanding that, she said you couldn't even go forward with new work and new epidemiologic studies in the place. And that's really what she had in mind. The traveling together was just the side perk of getting to know her and the community in which she was so embedded for so many years. But it was just wonderful.
I was thinking that was the maybe partly, it's something we sometimes lose. I think in psychiatric, in the epidemiology part of psychiatric epidemiology, the kind of importance or the value in embedding yourself in that context is something I don't know that we always teach that, or we can lose sight of it, because like we mentioned in the beginning, we can download big data, so you can kind of get data from anywhere, and so that's so important. And how she embedded herself in that and had lived in that community and knew it, like was so connected to the community, that the area that she studied. I think that's almost unusual anymore.
Well, also, I think part of that, and Josh, you can correct me, but I think that's partly being trained as an anthropologist. Like the fact that she came from anthropology meant that she thought about the impact of culture on how people lived and how they answered questions, and had the sort of qualitative researcher background that made you think really carefully about all of those influences on research. I think that's part of the legacy that's really powerful, and that all of us have, taken in from spending time with her.
Yeah, no, I agree. And I think what's exceptional, she started work at a time when really there might not have been such a clear separation between, we think of it as anthropological work or sociological work or psychiatric work. I mean, there were kind of very overlapping traditions, seem like, in the person of Alex Layton and others, and Jane herself. And what's interesting, actually, she really took a more, compared with other anthropologists, and maybe with kind of where most of anthropology went, she really took a more empiricist approach, which I think all of us here, have a deep appreciation for, really than the field of anthropology did. And she really stuck with it. And she's kind of a connection for us to, contemporary epidemiology, to that early period as well. I think that's an important piece to remember.
Yeah. Another aspect of this is just the practicalities of, before there's a data set to download, the carrying out the Stirling County study over all of those decades, there was not a pre-built infrastructure there for survey sampling and implementation. That was imported by the team, by Jane and Alec. They did that over a series of summers, and brought in hired interviewing staff and brought them there and trained them and had them embed in the community. And it was so there was the huge practical challenge of that they carried out, and it was also a service to the community. And one of the aspects of the study that she would tell me about is the mental health clinics that were set up in the community to serve the local community as well. And so there was always a sense of giving back, in addition to asking in the community to participate.
Yeah, that's actually really, I didn't actually know about the mental health clinic, so that's really incredible. So just some things that have been shared. So in the Q&A, some of her family members who are on the call have shared that how what a great grandmother and aunt and family member she was. But I just want to read one because it was very consistent with what we're reading. Julie Murphy CV said that, thank you so much for sharing your memories and thoughts about her life and research and teachings. Aunt Jane was always a delightful presence, supportive, a wonderful listener. She was not directive or judgmental, which is everyone else is saying. She was always curious and wanting to expand her life to the fullest, even to her last day. And it's fun to hear about all your experiences with her, and expands their view of her as a family. So that is really nice. Thank you, Julie, for sharing that. Paul Johansson, who's shared a number of things, said, I believe she only grew up only with brothers, which partly explains her determination. So about that, I don't know if that's true, but she was very, very determined. I don't know. So before we're going to end in a minute, anything else people want to share to conclude?
I had one other thought about, and it again comes back to Stephen's saying something about teaching us how to be academics, because I was speaking to my brother's father-in-law, someone we're very close to, who's a professor at Stanford. And I was saying something like, she had the death we all want. You know, she was working until a week before she died. And it was great talking to Jim, who thinks the same way, but you realize in the regular world, working until the week before you die doesn't sound like a good thing. But this is the life we want to lead. We have the privilege of doing something that we care about and we love. And the idea that Jane and Stephen and Rebecca were still collaborating and talking to each other about these important issues that she cared about until right before she died is something that I also find inspiring. And she just really showed us how to live as an academic. Not everyone's lucky enough to be as sharp as she was in her final days, but in every part of her life, how you take care of people, how you take care of yourself, how you invest in your world. We all tend to sort of have our personal life and academic life in many ways intertwined, not necessarily directly with a partner, but through the hours that, you know, are kind of have no boundaries, through the thinking process that has no boundaries. And I really think she set the tone for that, and she died as she lived. And that for me is really something that's inspiring and lovely.
Thank you, Deborah. That was beautiful. Thank you. Is anything else anyone wants to say before we end?
Maybe just, a lot of us have also seen Jane at conferences and sort of in other broader academic settings.
Yeah.
And for all the wonderful, personal, sort of delightful, graceful things about her, and Jane can hold her own. And I don't think anyone, everyone, all of us who have seen her at meetings knows that Jane was always held her own ground and was a force in advocating for the science that she believed in, the positions that she had, the role of social standing, even in the face of the waves of genetic research pouring on top of and even displacing or crowding out social science research. And she was a strong advocate for all of that.
Right, and for measurement, things that seem to have, expressed, even if her, was very strong in her opinions, even if they went against the current trend, which is something else I learned from her, the kind of the steadfastness in the topics and issues she cared about, even when they were in and out of fashion. So, well, thank you, everyone. That was beautiful. And thank you for everyone who joined us. You see a lot of, in addition to some of Jane's family, I just see a lot of, kind of prominent people in the field, or people that she's mentored. Jordan Smoller was on here, Jill Goldstein, Alex Cohen, Garrett Fitzmaurice. So a lot of people from the community that I know she had an important role in building her career. So thank you, everyone. We will share the link when this will be posted and online, and we will share it and captioned, and we'll share it, and everyone who's attended will get the link, so can share it. I also wanted to mention before we end that Susan Santangelo shared with me this morning that APPA has a fund that they've started in Jane's memory to support students and student participation in the American Psychopathological Association. I put the information in the chat, but if people want to look, and we'll send out that link, if people want to donate, they can donate to APPA and indicate in the notes that it's in Jane's memory. Thank you all very much. And I hope everyone takes care. We will have our last mental health forum of the semester in June. I think it's June 16th, which will be on looking forward in mental health after this year. But thank you. And thanks, Josh, Stephen, Olivia, and Deborah. I really appreciate you being here, and for everyone who joined us.
Great. Thank you so much.
Great to see you.
Thank you
Take care,
for
everyone.
organizing this. It's wonderful to see
Take
everybody.
care, everybody.
Bye.
Bye.